Oh, hey there, this is Dr. Evan Osar with Discover IMI, Integrative Movement Institute. Welcome to this edition of Integrative Movement Insider. Happy Monday. I hope you had a great weekend. It's another gorgeous day here in Houston, Texas. In today's episode, welcome again. Thank you for being part of our community and allowing us to be part of your community. In this edition, I'm going to talk about a subject that many of your clients likely talk to you about, especially if you train the older population. Older folks being people 50 and older, like me. A lot of your clients come in with low back pain and or mention they have low back pain. In fact, I just had a client come in the other day. He took some time out. He's like, I need to take a couple of weeks off, and he's a new client, and he didn't really know me very well. So he's like, I'm going to go to my doctor. I'm like, all right, go ahead. Let me know what he says. So he comes back. A couple weeks later, he's like, I'm ready to get started again. And he's like, my doctor said I need to strengthen my back. And I'm like, okay, what did he look at? What did he evaluate? What did he see that determined that you need to strengthen your back muscles? He's like, there's not a lot of muscle back there. I'm like, well, that's very interesting that of all the things about you, that's the first thing he noticed was, oh, you don't have a lot of back muscle mass. One of the things that will make me not put a lot of credibility into what some doctors say, and again, I want to be respectful to all doctors out there, be respectful to other approaches, be respectful to my clients. However, if your client's medical practitioner is not doing a thorough evaluation, if they're not looking at posture, looking at the client's motor control, and most importantly, looking at your clients, how they're breathing, their strategy for breathing, then I don't have a lot of credence about what you tell me about this individual and what you want me to do with them. Now, again, I can take on the liability as a chiropractic physician with my malpractice. I can take on the liability of trusting what I evaluate on my client and what I think is the best thing going on with my client based upon my evaluation, because I'm taking my client's history, I'm looking at many different factors, their range of motion, their motor control, their breathing strategy, their areas where they may have muscle atrophy and or excessive muscle mass. So I'm doing a comprehensive exam, which very few, if any, medical doctors are doing and or orthopedic surgeons are doing. So will I put my trust in my evaluation and my clinical skills? Absolutely. Above the orthopedic surgeons? Absolutely. Now when it comes to surgery, yeah, I'm deferred to that individual. Now it's important that after I say that, there's a caveat that you work within your scope of practice and that you be respectful of this individual. So I'm not going to badmouth this medical doctor to my client, but I'm going to say I humbly disagree, because these are the things that I have found that we need to work on. And either he can agree to work with my approach or he can agree to use his doctor's approach, which probably will not get him very far, because again, he's an individual who has a very extension type stabilization strategy. He's got a distended abdomen. He's got a wide infrasternal angle, so his rib cage is up like this, distended abdomen, and he's not an overweight individual. He bears down. His face is red most of the time. He has high blood pressure. He's got a history of rotator cuff surgery, hip replacement, knee replacement. He just tore his hamstring. So you're going to try to tell me that low back muscles are what need to be strengthened to help this guy? I'm going to respectfully disagree. Now, what is this ball? Going back to this ball. Well, one more last thing before we start, before I continue. Again, be respectful, ask the questions. You can have a conversation with a medical doctor. Hey, what did you see, doc, that made you think that he needs to strengthen his low back? So again, have a respectful conversation and don't work outside of your scope of practice. Now, to the ball. What does the ball teach us about low back, spinal stability, or stability generally speaking in the body? What's cool about this ball, and using this as an analogy for your clients, because they sort of get this. When we are stable, when we're controlling pressure, basically what keeps us upright, our muscles keep us upright to a certain extent. We need muscles to hold us up against gravity. That's a true statement, absolutely. But what do the muscles contract against? They contract against bones. But what do the muscles and the bones, ultimately what holds them up? It's internal pressure regulation. Here's what I mean. It's like this ball. If you think about the lining or the ball itself, the rubber that makes up this ball, that's like your myofascial system. Okay, obviously you have bones inside your body as well, but just think of the covering of this ball, the material of the ball, as your myofascial system. The air inside is the pressure that's inside this ball that keeps it from deforming. So when we think about our body, it's like, what keeps our body from deforming against the forces that are working against it? What are the forces working against our, we'll just focus on the spine and rib cage. What are the forces acting against our spine and rib cage? Well, obviously we have gravity pulling us down, exerting a force, and we need that force to contract against. We need that force for muscle and bone density, muscle development and bone density. So gravity is a good thing. But again, gravity is still compressing us down. What else is compressing us down? Muscle contraction. When our muscles contract, they are contracting, they're pulling us, relatively speaking, down and compressing across their attachments. Now, that's a good thing as well, because again, it builds muscle mass, it allows us to move, it allows us to resist getting pulled to the ground, it allows us to move massive loads, or even light loads. It allows us to move effectively. But what are these muscles contracting against? And what do we need so that when the muscles contract, they're not over-compressing upon our joints? We need that internal pressure regulation. How do we get internal pressure regulation or optimal internal pressure regulation? We need to breathe three-dimensionally. And when we talk about three-dimensional breathing, it's breathing from the first rib all the way down to the bottom of the pelvis, all the way around the cylinder, this theoretical actual rib cage over top the pelvis, this thoracopelvic cylinder. We need to breathe from the first rib down to the pelvic floor, all the way around the cylinder. And then also we need to breathe front to back. That's essentially our internal pressure regulation when we're breathing and using an optimal pressure regulation strategy. That helps blood flow, that helps lymph flow, that helps the cranial fluid flow, or the cerebral spinal fluid flow. So again, we need that pressure regulation. And then we need that pressure regulation so that when our muscles contract, they can contract against this pressure and that doesn't over-compress us. But here's what happens. We don't have good breathing. Many of our clients do not have optimal breathing. They're breathing too much into their abdomen. They're breathing too much, or they're breathing too much into their upper chest. They're not breathing around their back because they're overly using their shoulders to pull down, or their erectors to grip and hold themselves up. They've distended their abdomen, so now they're breathing this direction. That's why we have pressure regulation issues or problems. What are pressure regulation problems? Low back disc herniations, abdominal hernias, urinary incontinence because too much pressure is going down to the pelvic floor. We have issues like sports hernias. We have issues like gastroesophageal reflux disease, GERD. So pressure regulation, when you're not controlling, the diaphragm's not helping control the position of the esophagus and the stomach itself to help close off the stomach. The diaphragm is a big portion of controlling pressure through the abdomen. So we have lots of pressure issues that manifest as these sort of physiological issues in our body. High blood pressure is another pressure regulation issue. So the better that we get and help our clients evaluate their breathing, get them breathing three-dimensionally, we're going to help a lot of our clients even with things like low back pain, mechanical causes of low back pain. And yes, I know there's cognitive or I should say neuroplastic issues of the central nervous system that cause low back pain, but I'm talking about and referring to mechanical low back pain. So physical tissues causing low back pain, like your facet joints, like your joint capsules, like your disc herniations or bulges and things like that, like actually myofascial pain from the fascia and or muscle tissue. So what can we do? The most important thing we can do is help our clients develop a more optimal three-dimensional breathing strategy. And we've talked about that many times here on our Facebook channel. First, breathe through the nose. Second, slow breathing down. Third, get breathing through the entire cylinder so the individual can use their entire thoracopelvic cylinder. Third, teach your client, fourth, teach your client how to brace and then breathe and brace at the same time so they have that strategy when they need it. Teach your client how to use a better core stabilization strategy and not grip from their hips or grip from their shoulders too much. And here's a great way. So you also have to teach your client how to not only breathe when they're lying down, because that's where we start our clients, either lying face down, lying on their side, or lying supine. But we need to teach our clients how to breathe when they're standing up as well, because again, that's where a lot of the exercise, obviously, everyday life happens standing up. So one of the things that I've been working with a lot of clients just to get them the idea of breathing optimally is just take a ball, usually a smaller ball, So individuals can pull it into their abdomen gently and then wrap their hands around it. So that way they can pull it into their abdomen, and especially for these clients that have this real extended, that wide infrasternal angle, so the angle between the two lower ribs and that distended abdomen. Have them pull it gently into their abdomen, wrap their hands around the ball. And then I'll have them just focus on breathing into and around their back. So they're breathing up the spine and around into their mid to low back. You can have them do a couple squats in this position. Hold that squat isometrically, so they're learning how to control breathing. When they're moving, I can have them hinge, so I'll use this position a lot, so they learn how to stabilize their spine in a lengthened position and control that pressure regulation when they're in a loaded position. So great ways to start to train your client how to use three-dimensional breathing in the upright position, so they understand and can coordinate breathing with the ability to use their core muscles. And it's not about just one muscle, like their back needs to be strengthened, or their abs need to be strengthened, or their psoas needs to be strengthened. It's about all these muscles collectively working together to maintain that upright spine, maintain three-dimensional breathing, and then coordinate optimal movement. And of course, then you also need to train your clients how to move away from this constant braced position. So again, we'll talk about that next time as well. So I hope that made sense. And I hope it helps you, give you a way to explain to your clients why it's not just about muscle strength. Yes, you need strong muscles. Yes, many of our clients need more muscle mass, size, so to speak, more strength. However, they need a more optimal strategy and to put strength on top of that more optimal strategy. So that way they breathe better, that way they move better, that way they lengthen their spine, they decompress some of these compressive forces, gravity, the muscle contraction, any external loads you put onto the spine, and then they have a better strategy for everyday life, for things they want to do, like it's getting beautiful out here, so people will be gardening, so they have a better strategy for bending and lifting and sustaining that bent over position. So you're really helping your clients develop a strategy for life. I know this was a bit longer than our normal post. I hope it made sense. And I hope it, as I said, it gave you a way to explain why it's not just about strength when it comes to clients that have chronic issues, especially things like low back pain. If you have any questions, put them next to this video and I will answer them. If you disagree, for sure, put them in there. I'm an open-minded individual. I'm always open to learning and open to new approaches or ideas, so put them in there as well. And until then, keep doing what you're doing, keep educating your clients, keep empowering your clients, help those individuals discover strategies to do the things they need to, want to, and love to do. And that way you'll be that go-to expert and attract more individuals that need, want, and will pay you for your expertise. Thanks so much for watching. Thanks for being part of our community. Share this with like-minded individuals, and we'll see you next time here at Discover IMI, Integrative Movement Institute. Take care. This is Dr. Evan Osar. Have a great day. Have a great week.